All right, so first in the series, you know, a lot of people ask about getting a lab to where you can walk with not pulling. And I think the thing that I did with her was she needed to make sure, I had to make sure that she knew I was the one in charge. Stop. Sit. So once you gain that confidence with a dog and they understand that you're in charge, everything changes. But I think you have to get that. I tried everything. I tried the choke collars, the pinch collars. I tried it all. And of course she's 6 years old, so it's a little different, but she knew. So when she would get ahead and start to really pull, there's a couple things that you can do. One is you can put a little pressure on the collar. I wouldn't put too much because right now she doesn't have a choke collar on. Not a choke collar, but a pinch collar I used. But what I would do is I would stop, like slowly stop like this, and just gently move her back around. So at that point, she knew that she needed to stay by me. So you can see, I mean, she's right next to me. The goal is to, when you stop, I had her to a point where she would sit, but she did just have ACL surgery. But even there, she knows what she's supposed to do. Sit. So sometimes she'll do it, sometimes she won't. But if I really wanted to push it, I could have her sit when I stop. But like I said, heel. She just had 3 months ago, she's recovering, and you can see her back leg, which was this leg. But the other thing is she knows she's supposed to be on my left. So when she's not on my left, this is not normal for her. So she's not feeling good about that. Because like I said, she knows her place is on the left. So again, the biggest thing is with any dog is you have to gain that control. Like even there, see, she's trying to get a little ahead. And what I'll do is just put a little bit of tension on that so she knows she's not allowed to do that. So there again, a little tug on the collar, and she sits. Now, some dogs will sit immediately. Now the other thing that I did was I taught her when she's in a sit, she's not allowed to move. So I can walk as far as I want, and she knows until I tell her it's okay, she's not allowed to move. Which is phenomenal for her. Sit. So, of course, she broke it. Now, sit, stop. So I'm not gonna reprimand her for that. She's a little excited. But normally I can have her just sit. The one thing that I did, and I think it's important, is to not, when they do wrong, it doesn't do you any good to smack them or to get real aggressive. She doesn't respond to that. She responds well to good praise and, you know, treats. I don't know. I mean, she will do anything for food, but I never really trained her with treats because I figured if I trained her with treats, then I would always have to have treats. Of course, she wants to go play in the woods now, and we're not doing that, but right now I'm still, like I said, I'm still nursing her back from that surgery, but she's ready to go after 3 months. So anyway, that's about it. You know, here's a good example. There's a dog barking. She wants to run. She wants to get ahead. Heel. But she knows she needs to stay on my side. Slow. There goes a squirrel. She didn't even think about chasing it. So it's just a lot of work, and you got to be diligent and make sure you don't give in. I walk this dog every day, and you can see she's still trying to pull, but she's close enough.